Welcome back, Anna. Before the break, you were mentioning about starting of MSc nursing, so you can continue your thing.
Sure. This PG program, MSc program has given a lot of things in my life, especially my family life has made in PG. I met first time in my wife
Oh,
as a
okay.
classmate there,
Okay.
and where I can say that my the first means the love started. I cannot say it's the first love actually. My love for the life has started there actually.
You cannot lie to
And
me anyway.
yeah, the first sight itself, I understood that she's
Mm,
my girl. And
mm,
later on, I just, after some few months, I just proposed and all those things
mm,
just went on. I understood that my life is going to start from here.
mm,
And the education, I should say that like we enjoyed. We
mhm.
enjoyed our teachers, especially like Dr. Jaishilan sir, Madam
Definitely.
Tamilmani. And the
Mm.
main pillar of my life is Jesse Sudarsanam in medical surgical
Okay,
nursing.
okay, okay.
And I
Yeah,
used to,
yeah.
she
No,
was my
I
teacher, she
understand.
is
She
my
was
teacher,
your mentor. Yeah.
and she is my mentor, and she's everything for me actually because she
Mm,
from basically from CMC Vellore, and she worked a rich experience in
definitely.
medical surgical nursing, and we had a very nice time actually. Nice time means she used to be very strict actually. So
Yeah,
that's what she wants, everything in a discipline, in orderly way.
exactly.
That one way like which made me to be competent with and challenging with all the activities, especially so far where we have studied and learned and everything, it just went on formal, mean sorry, informal. And
Mm-hmm.
here we had a very formal documentation, which is in
Assignments.
like technology we have adopted, means trying to adopt, and we use taking a printouts actually.
Yeah, the
So our way of
computer was
like
only coming in, evolving
yeah,
that time.
yeah,
Yeah.
yeah, yeah. Computer it started like involving
Mm,
from the year 2000
mm,
onwards, and 2002, 3, 4, and those
mm,
days we have very limited.
exactly.
Means like we had only one or two computer centers, which like 20 students in within a night we need to take a printout. Means
Exactly.
especially like it's a competition between us also. Means I used to take large numbers of papers, and other people
Mm,
type things, and other people like want to make it one or two, three, or 10
mm,
papers, but minimum our standard will be like we make a books actually. So
mm,
competition will be happening, it more amount of content when we make it. So we just what to say, so we are rich enough to bring the content to the classroom. So
mm.
we say we think like that actually. So
Yeah, I
it
know.
went on like a competition. So
Mm,
between us, we used to what to say, for with one man,
mm,
we pay a lot of money for getting a type and taking a printout. Especially, we cannot say take a one printout actually. The entire class, and we our batch we had more than 20 classmates.
mm,
I'm saying about 2002, sorry, 2003 4 batch
mm.
actually. 2003,
O-
2004 batch we have studied. So we
Okay.
need to take for 20 members, we need to take a printout. Not
Mm,
even a one or two pages actually. Even if we take a 200 pages like printed material, the 200 materials, paper materials needs to be given into 20 actually.
yeah,
So
yeah.
20 members, we need to give the same material.
Oh,
So it's
copy
a
to
very,
all
very
the
huge
classmates.
a
Yeah.
copy to all the classmates. The same thing, not like one or two papers, just like a master plan alone will not be sufficient.
Mm,
So
mm,
we need to present. We had a
mm,
very, very nice, interesting time. Our
mm,
supervisor or our guide or madam will be like, means evaluating and correcting in between, and all the commands will be happening it. So it
mm,
was went on very strict and very disciplined way. Like we had all the seminars, minimum, maximum, we had a 200 in medical surgical nursing, especially all the specialties. Each person will have
mm.
of more than what to say, each time, each semester, each term, month, we will get minimum 20 papers we will be getting it actually. The subjects
Seminars.
will be,
Mm,
each seminars will be
mm,
getting it.
mm,
So that will be divided. For example, one system will be divided into all
mm,
people, and we will be presenting in front of the Madam Jessie Madam, and corrections will be happening. It the learning will be taken place, and lot of additional materials, additional technology trends, and other things also will be discussing in those seminars. So it
mm.
was very interesting, quite interesting. We learned actually.
Mm.
And as we know, like nursing education part, like Madam Dr. Tamilmani Madam used to, that also will be happening by seminar also.
Mm.
I
Mm.
remember our biostatistician sir, even 6 months back, I just went to Erode and I met him actually.
Dhanapal, is it?
Uh,
Was
Dr. Dhanapal, Dr.
Dhanapal, yeah.
Dhanapal,
Okay.
and Mr. Dr. Murugan sir,
The-
sociology,
Are they
means
all still
sociology.
there?
Yeah, still there. Now Murugan sir is left there in JKK, and
Okay.
he's doing some of the consultancy and other lot more educational activities also.
Okay.
I think he is going to start with the institution also, like some of the educational institutions. So just he's also doing actively involving in the professional activities.
Okay.
And community, when we say community, we enjoyed with Madam KCR. Even 3 months back, I just went to JKK as a resource person. So I
Mm-hmm.
met Madam, and she's also working in one nursing college. I think Vallalar Nursing College in Erode.
Okay.
Madam is working, and Muthu Lakshmi. There are so many people for community department.
Okay.
And we used to remember like OBG, this one. That name, I'm not remembering it actually, his name. Um, Anita, OBG, professor,
Oh, okay.
those days actually. And
Okay.
Korean medical surgical, one of his husband. We had
Oh,
a very nice, good, interesting, and learning had happened in our PG days actually. And
okay.
I should say that the first day when I joined in PG, we
Mm-hmm.
all like in a one room, that is in
Mm-hmm.
a ghost bungalow. That's a very quite interesting, Mr. Mogan Raj actually. Sir is
Yeah.
now, he has got own college now.
College, yeah. I
He's
heard.
working in he's there in a Mysore with Dr. Vijay Lakshmi. She got
Mm-hmm.
PhD from one of the Mother Teresa university in this one.
Kodaikanal.
And he has got Kodaikanal, and
Mm.
he got his own institution and own land, and he just well established. Actually, he's doing his PhD right
Mm.
now in Ramachandra Porur.
Okay.
So he used to ask us a lot of things and procedures and policies and all those things in between to me. And we had a very good team there actually. Prince was there. And
Mm.
nice days actually. Those days
Mm.
what I have spent initially in good
Mm.
team. Then we all like went to different places, and it went on like that actually.
Mm.
So totally that PG experience, it's went on very good and very nice experience, very good learning, and which has given me the backbone or spinal cord
Confidence, yeah.
in me,
Mm. Mm.
confidence in writing actually.
Mm. Mm.
So
Mm.
that has given me like a lot of like mindset to write.
Yes, Anna. Um,
Like the formal way of medical surgical approach, which has given me to prepare anything at any level actually. Like
mm.
she has given me a master rotation plan, start from the definition to rehabilitation or conclusion, which is given the structure, how to write
Mm.
and what to write. For example, when we say about the pathophysiology, it is
Mm.
most important. Like when we need to remember about pathophysiology, it should be in a flow chart.
Yeah. Yeah.
So
Mm.
every student, when they understand about the flow chart, and they can easily write about the pathophysiology. Same thing like when we say about like investigations, so
Mm.
means diagnostic evaluation. When it's idea is given, like it's giving a invasive and non-invasive, and which
Mhm.
should be like a system wise, like starting from the head to toe. Like
Mhm.
we need to organize all the systems. So
Mhm.
the same thought of like idea or concept which I apply even today in my books actually. So
Books. Okay.
that's what the it makes very simple. It makes
Mhm.
very simple, like they understand. So when as a author, we should stand in the position of a student.
Mm.
As a student, how you expect from the books, what you expect from the books is most important. Like diagrams are most attractive,
You know,
which retain in our mind for quite a long time.
and
So like more diagrams, more flow charts, more tables, which is, and especially like my approach in writing a book is we need to create the individual special things. What I feel is like everything should be a mnemonic.
yeah.
It's a
So,
mnemonic learning is most important.
no, sorry to interrupt you now. Is Professor Sudarshan still coming, or is she
Yeah, I
retired? Or?
just I met Madam 6 months back. Actually, she's in a dementia. I very sorry to say that she's okay,
Okay, but
but
later.
still she's in some of the health issues she's facing it.
Okay.
and some of the problems in identifying a person and all those. She's very weak actually because it's so long. She's very aged
So,
person.
sorry to
So
hear
it's there is a age-related problems
problems.
is occurring. It, but as my teacher,
Mm,
as my teacher, I used to visit Madam every six
mm,
months. I take a blessings from her before I
mm,
start any new textbook actually.
okay.
So I need a blessings. I need a good relation, lifelong relation from my teachers, my
Excellent.
friends.
Mm,
The way whatever things it happens, my classmates, I want to
mm,
maintain a very good relationship lifelong.
okay.
It's not just like a formal. It should be like informal, and it should be like more emotional and more attached.
Okay.
I need from
Mm,
everybody actually.
okay. So you started saying about your life partner that you met in who you met in JKK, and then
Mhm.
I believe you got married while studying, or you got married after the studies.
Yeah, it's a good thing we can discuss right now. But I have not so far discussed about the professional journey and professional, what to say, things
Yeah,
about
no, no, no.
things we have not entered.
I know, I know.
Only the personal things we are just rolling around.
Yeah,
The
yeah.
thing is, my personal life, the day I met Nisha, I just
Mm,
thought that she's my person. She's my life partner.
mhm,
I learned it and I approached and initially she has not answered and later because she's from the different background actually.
mhm,
I
mhm,
basically a Tamilian and she's Malayali
mhm,
and they have native is in Kerala and they have settled here for her education in Europe. So
mhm,
when I approached her, and she say yes or nothing. She said actually. Then
mhm,
later, the time went on. We went for many places for review of literatures, and especially for first year, we used to go for a madam used to send for education related materials to be collected for seminars. Actually,
mhm.
we had different types of what to say philosophies,
Okay.
educational philosophy means
Mhm,
realism
mhm.
and
Positivism.
like
Mm,
theories, Gandhiji theories and all the theories, like philosophies we used to when she sent
mm,
us for the teachers training school and we collect for material. And that's those the in those time like when we travel, we just approached actually.
mm.
So our thing started there. It's one big story actually. I'm not coming very big into that actually.
It's
So
okay.
our
It's
life
okay.
started
Fine.
like that. Our life started. Presently, we are living in Bangalore. We have three children. The first
Mm,
one is now doing a MBBS in St. John's Medical College. Now, first second year is completing it.
okay,
And the
man.
second is daughter is I'm planning. She twice she has written NEET and trying for MBBS. But my plan is for her is doing a nursing is the best option. I just planned for her. And the
Okay.
last one is studying 11th standard actually. So three children. I got a very late marriage actually. At the age of 35, I got married.
Okay. Okay.
So so life is going on like with three children. We are living in a Bangalore for
Mm,
of from 2004, no, not 2004, 2005
mm,
onwards. Now
mm,
20 years we are living in Bangalore. Only for
mm.
children's education we are just settled here.
Okay.
And a lot more like professional activities also, just like
Mm,
making myself to keep doing it actually, to keep growing with profession.
okay. Okay. Now, so coming back to your nursing journey, so just to summarize, I mean, I just want to summarize until now, then we'll go back to, I mean, we'll go to PhD and other things now. So you have started your nursing from very basic, and as you said, you are from Tamil background and everything, and you went to Coimbatore for studies. Then you worked in Chennai. Then you went back to Saudi Arabia for work experience. Then you came back. You searched for a good college for doing PG degree, and you got a consultation. So this is very important. We need to have a lot of advices before doing anything. So you had that kind of social network, professional network, to help for your decision to make a decisions. And I remember you were saying something about when you worked in Miat Hospital, you were working as executive. What was that? Anna? Was it executives?
Executive, it's an executive nurse, which is
Okay,
like it's a more than a head nurse actually.
more than a head
Means it's a
nurse.
complete control. Like I used to train, teach.
Okay.
and
Okay.
conducting a research. All these activities, like it's a together. It was my assignment actually. Even
And
conducting a research, small researches like why infection control and all those thing perspectives. I need
exactly.
to means I need to do a small study on it actually, and
Okay.
why the morbidity, comorbidity means the reasons for getting a infection, additional means nosocomial infection actually,
Nosocomial
how
infection.
the
Okay.
people are getting
Mm.
it, and like the small studies were conducted by me
Okay.
and the team. I need to train the people for the providing the complete care for unconscious patient. Most of the
Okay.
patient will be means we have a 12 to 18 patients will be there in one floor.
Mm-hmm.
We will have a means 6, 7, 8 nurses will be there. So I need to lead them. I need to teach them the complete report from morning 7 o'clock to evening 7 o'clock. Even 24 hours, I need to be means note the patient's care actually,
Yeah.
especially like maintaining fluid intake charts and maintaining their complete assessment,
Mm-hmm.
complete implement interventions needs to be like a means I need to be supervise all the nurses and all those things.
Okay.
The complete
And
care I need to be supervised. I
the
need to
reason.
involve
Yeah.
any practical problems. See, I need to coordinate nurse and the doctor. I need to
Okay.
schedule for the duties of their the nurses, and
Yeah.
all lot of activities will be there.
The reason I asked this because as I am in a senior management level, I used to face a lot of conflicts and a lot of problems from staff, colleagues, and my senior, I mean, my boss and everybody. So basically, you needed to have that kind of, being a nurse, you need to have that kind of resilience, coping mechanism, and what else? You need to develop yourself every time. You need to utilize every opportunity as a learning opportunity rather than being criticized all the time, wondering.
That's a good word you have mentioned actually.
Yeah.
So every individual has got some one or the other potentialities, even the
Yes.
staff nurses.
Yeah.
So learning our approach as a leader, as a
Yes.
leadership quality, the leader's approach should be like learning from others,
Exactly.
giving a correction and giving a like they should feel as a one of their member team member in their life actually. They should be a free enough to interact.
Yeah.
We are not there to identify the problems actually. We are there to solve their problems. So
Exactly.
then you can maintain a confidentiality, you can
Mm-hmm.
maintain a good relationship. It is
Mm-hmm.
more than a working relationship. We need to maintain a personal interaction, personal interpersonal relationship is most important.
Yeah. No, I,
Therapeutic relationship,
mm,
therapeutic relationship is formal.
yes. Yes, I know.
Interpersonal relationship is like informal.
Professional. Yeah.
So
Mm-mm-mm.
that we understand, we need to more than we professionally
Mm.
handle and tackle with them, and we need to be good human being with them actually.
Yeah.
So
No.
they really
Yeah.
relate, really we can means more than we learn from them, and we need to they should learn more from us actually. We need to
Yeah.
listen their problem. We need to understand the ground level problem
Okay.
as a leadership quality and manager, and
Mm.
we need to know about like we need to give equal importance.
Yeah.
It may be a doctor or it may be a healthcare team members are equal.
Yeah.
They
No,
need to be respected.
yeah, I totally agree with you. The question I just want to ask for our young nurses on behalf of our young nurses is like while when you started a when you started a fresh institution, or when you are a new person, or when you are new into the practice, there might be some that you might have got some criticisms or some blames or some you might have felt, why did I come into this institution or organization? Have you ever felt any time very have you ever felt low, or have you ever felt depressed choosing this profession?
It's a it's a good question you have asked.
Yeah.
The thing is, I never felt in my life I just come for this nursing profession actually, because
Okay.
I know what is nursing. It is a
Okay.
helping profession. Basically, we need to give our life to somebody.
Yeah.
So it is a very, very, what to say, it's a very, it's a service oriented profession.
Yeah,
So we need
yeah.
like a strong motivation, like I should say, like freely right now, Dr.
Hmm.
Rajani, in those days when I started doing a nursing,
Hmm.
with those days we don't have a mask and we don't have a glove actually.
Oh, yeah.
So every day, what we do,
Mm-hmm.
we manual evacuation by
Mm-hmm.
our hands, our
Mm-hmm.
fingers, without any glove.
Mm. Understand, yeah.
So we understood. This is
Yeah.
nursing is like somebody, like helping their somebody's pain, helping, supporting
Mm.
somebody, and giving a comfort to somebody. So we need to be, our mindset needs to be prepared actually.
Yeah, no, no.
So every
I
day, I should
mm,
say that like every day, I
mm,
need to do even for my lunch. I just evacuate two, three persons
stool. Mm. Okay. No,
constitution.
yeah, I get you.
So it's just one simple example. We can
Mm-hmm.
give even uh, within a day when I work in an ICU, in a
Mm-hmm.
neuro ICU, we
Mm,
used to get a brain head injuries.
mm,
Two, three death may be happening in my hands.
mm,
So they come. I need to prepare them and everything, and
mm,
they die in
mm.
the fraction half an hour to 1 hour. People will be gradually getting comatose, and because of because of their problems, because of their nature of injury, severity of injury, it's
Okay.
a huge. And the Glasgow coma scale and everything is just it's a dropping means hours to hours. It is
Yeah.
very difficult. Even if you give a cardiac compression, which we cannot brain, once the brain death is had happened, it's
Mm.
a total.
Okay.
So like like I pack two, three dead bodies,
Mm,
and I
mm,
understand real nursing actually.
mm, mm.
Real nursing. When I started learning that reality of nursing, so I can teach the compassion of my students. So this is the way your mindset should be there. It is not only by the professional learning you will take,
mm,
it's more
mm,
than that, blessings and a lot of other things are involved with our
mm,
nursing is the, I would like to say even to the anybody, nursing is a
mm,
profession, given me everything, which will give
mm.
it for me, not only to me. We need to be very sincere, very dedicated, very
Mm.
much committed towards
Okay.
our profession, to love our profession,
Yeah.
which we cannot, we should not see that like, which is, anything is, nothing is difficult actually.
Yeah. And
Everything,
yeah.
the
And
opportunity for learning.
yeah, I hear you, and I have more. I mean, I would like to have more discussions and interactions about this one. Say in our next episode, I'll get back to you in few minutes.
For that, I just want to complete one word that
Yeah.
like, I never felt in 38 of years of experience,
Mm.
not even a time or one day, I thought like why I came to this profession actually.
There
Till
is
this
no.
every minute I enjoy, it may be a teaching or it may be a patient care or it may be a research, just helping others to grow. And the same time, we need to grow by looking and listening and taking message from the other's life also.
This is a great word, Sana, and we'll get back to you and we'll discuss more. Thank you.